So why do you think it's so important to take out this entire capsule? I feel like it comes up a lot. We're extremely committed to it. Makes the operation a lot harder. But every case, we take out the implant and the entire capsule.
I mean, I think the main reason to remove the entire capsule, something that we've known in plastic surgery for a very long time, is whenever you have an implant, a breast implant, you develop what's called a biofilm, which is a, what's the right way to describe a biofilm?
I like to call it a trench that the bacteria digs to hide from anything that can actually kill it. So you could treat antibiotics. It's basically a defensive wall. And when antibiotics are given, the antibiotics don't make it to the bacteria, and they're able to evade anything that might actually get rid of it.
It's very, very difficult to eradicate a biofilm. We know that biofilm is the reason that patients develop a capsular contracture. So if the problem is a biofilm and that leads to things like a capsular contracture, perhaps an inflammatory response to the bacteria in the biofilm, how do you get rid of the biofilm?
I mean, you have to get rid of all the capsule and all the implant.
Yeah, I think that's the only way to get rid of the biofilm, is to do a en-bloc capsulectomy, remove all of the capsule. So when this question comes up, my answer, my thought process is, if the problem here is bacterial contamination and the problem is biofilm, you have to get rid of the capsule, because it's the only way to eradicate that problem.
And I think it's important to also mention that in our practice, in our hands so far, we're noticing that there's a pretty frequent rate of infectious specimens that pop up on our microbiology afterwards. We see these sort of quiet, indolent infections that come up on the cultures. That's why we're so committed to sending not just pathology, but the cultures, so that we can actually make sure that what we took out didn't have some sort of a chronic infection in place. But we're seeing how, I mean, it's almost over 20% of the time.
Over 20%. It's actually, it would surprise me how frequent, when we went back and looked at our data, how frequent there is this low-grade bacterial contamination. So it's something that we're looking at more seriously in our practice to develop a larger set of patients, but there's no doubt that this, I think, is part of the story here. And what we're trying to do is understand these different parts of the story. How much of the breast implant illness symptoms are related to a bacterial contamination, what percent of it is related to a silicone reaction, and perhaps what percent of patients have a bit of both.